Hi, my name is Miriam Johnson, and my informative speech is about the nursing shortage in today's society. My purpose is to inform about the nursing shortages and the effects that they have on everybody. They mainly have a lot of negative effects. Nurses are one of the most important positions in the healthcare setting. The demand for care of the aging population has rapidly increased, causing a very stressful working condition for not only the nurses but everybody else that's there. It really started when COVID-19 hit because a lot of the workers were being forced to work and help for all the sick COVID patients. And so they were being very overworked because they were there all the time. So it caused a lot of stress on them. This caused many nurses to quit, which was one of the reasons that there is a nursing shortage. And since all these nurses were leaving, the patients were not getting the proper care that they needed. Patients are the most important thing when it comes to healthcare setting. And when nurses are overwhelmed, they cannot get proper care to their patients, which can give them bad reputation. And also, not only that, but it also hurts the patients and can cause death, which is very important. They can have a negative effect on patients and nurses. One of the reasons I decided to talk about this is I have family in the medical field who have been through the nursing shortage, and I also just got my CNA, so I'm going into the healthcare setting, and I realized this is a big issue, and I wanted to research why and maybe find some reasons to help with it. So I think that's very important. So first I'm going to explain why there's a nursing shortage. Like I said, one of the biggest reasons is the COVID-19 pandemic, and it's because nurses are physically, mentally, and emotionally affected by the pandemic. They were expected to care for all these sick patients, and it was threatening the nurses' safety a lot because they were being around all these sick patients. And hospitals were full 24/7, and the nurses just reached their stress limit, so they just couldn't take it anymore, and they left the healthcare setting. And not only did it affect the nurses, COVID, it also really affected the patients, obviously, because they are very sick. And when they're sick and they can't get the good proper care because nurses are not there to help them, then it can really affect how the patients are feeling, and it can also give a good or bad reputation on the hospital, like I said. Our nurses is just a very overwhelming place, and many nurses said that the work overload and lack of fairness in the workplace, poor interpersonal relationships, and lack of empowerment was causing them to become burnt out. Nurses becoming burnt out was another big reason. A lot of these nurses were spending countless of hours and money to get their nursing degree, and they weren't even able to finish their career in nursing. They were probably only working 1 to 2 years. It's because they were just being in such stressful working conditions that they just couldn't take it. 225 junior nurses working in hospitals, and 67% were already experiencing symptoms of burnout and symptoms of emotional exhaustion and depression, which is very high numbers for just now starting nurses. Some nurses were already retiring at the age of 50 because they just decided they physically and mentally can't be in the profession any longer. For example, students were going through many years and years of nursing and only being able to work for 2 years, so they're spending a lot of their money and time becoming a nurse, and they just couldn't take it once they got there, which is kind of sad. So now I'm going to talk about how it really mainly affects the patients, which I talked a little bit about, but I want to really focus on that now. Nurses are very important because they do most of the work when it comes in the healthcare setting. The Bush administration said that they will not set a minimum number of nurses in the nursing home, but they're hoping it's resolved market forces and more efficient uses of existing and nursing aides. Because of this, what this is trying to say is they want just a little number of nurses in a nursing home, so they can work with just these specific patients on what they need. But say one of them are sick or they decided to quit or something, it's hard to get somebody else to fill that position. So without all these nurses, all these residents, these older residents are being harmed. And it's putting their lives in dangers. Patients can suffer from bed sores, malnutrition, weight loss, dehydration, pneumonia, and serious bloodborne infections since they aren't getting the proper care because the nurses aren't there to help them. Another important thing is the nurse to patient ratio. There should be more nurses than patients, but obviously recently there's been more patients than nurses, and more patients are assigned to each nurse. And a lot of these nurses are taking care of patients that they've never really known, or like what they're there for, especially in the nursing home. So they're not really like comfortable with their care plan. So that's why it can be kind of hard, because there's also a lot of nurses a lot of patients with a lot of these nurses who don't really know what they're supposed to be doing. And that can also affect the patients. And some of these nurses aren't able to perform critical tasks like vaccination and correct vital sign checks. So that can also lead to very important things, because if they miss something important in the vital signs, it can kill a patient technically. Now we're going to learn about the effect it has on the nurses. As I mentioned before, nursing is a very hard profession that leaves nurses very overwhelmed and stressed. Like I said, the nursing shortage may lead to stress and burnout, which will affect the nurse's performance and increase the chances of medical errors, which is a very, very important thing. Nurses are forced to work in very hard working conditions, and this can cause understaffed nurses when during the shift. And so the ones that are working are going to experience burnout faster. It also increases job dissatisfaction, because nursing is a very rewarding career, but if they're not able to give the proper care, they're not giving they're not getting the reward that they need. So overall, nurses are very, very needed in the healthcare field, and without them, it can cause a very negative effect on the facility and the patients. And due to all these reasons, the nursing shortage has a very negative impact on today's society.